Hello everybody, I am Dr. Siddhartha, Consultant Interventional Cardiologist, RN Tagore Hospital, Kolkata. Today I will be discussing with you about the most important disease in cardiology, that is coronary artery disease, which leads to heart attack and how they should be treated. First of all, you need to understand that our heart is a muscular organ which is constantly beating like this. This is contraction and relaxation, and with this movement the heart is pumping out blood to the entire body, and this blood is circulated in different organs like brain, kidney and all other organs of our body, and they are maintaining their normal functions. So from where does our heart gets this amount of energy or their own blood supply? Because heart has to pump and at each and every beat, so they also require oxygen and blood supply. This blood supply to the heart is taken care of by three arteries which are called coronary arteries. Now these three coronary arteries are lying on the surface of the heart and they are supplying blood to the heart itself, the heart muscles itself. Now these coronary arteries with time, with different diseases like hypertension, blood cholesterol or diabetes, they tend to block, and also with age they tend to block, and there are different deposits on the walls of these coronary arteries like calcium, cholesterol, dead cells and so many fragments in the blood which gets deposited on the side walls of these coronary arteries. And with time, just like our water basin pipe gets blocked with iron, rust and everything, these artery which we can consider as blood pipes also, they get blocked with calcium, cholesterol, fat and so things. So these blocks, when it goes on increasing and reaches say 70%, till that moment the patient is not having any symptom. The patient is carrying on his or her normal activities. Once there is more than 70% block, sometimes the patient gives symptoms, preliminary symptoms of heart attack, sometimes they don't. What are those symptoms? Those symptoms means chest pain. Chest pain particularly on exertion, that is walking or carrying weights or walking after meals or rising upstairs or running like that, or even in emotional or emotional anxiety or when the heart rate increases in certain situations. So at that time patient feels a heaviness, a chest pain which is radiated to the left arm or to the lower jaw and neck, and then it subsides with rest. So this happens only when there is more than 70% block. So patients need to understand that even a patient who is not having a chest pain can have a coronary block or a coronary disease which is building inside his body, and once it will be severe, then only they will get symptoms. And sometimes what happens is, after this 70% of the artery is blocked, gradually 80%, 90%, 95% gets blocked, and once one artery is 100% blocked, at that moment the patient will develop a heart attack. So heart attack is that moment when a coronary artery is totally blocked, 100% blocked, and at that moment one particular portion of the heart is devoid of the blood supply because the artery is totally blocked, so the muscles are not getting any more blood. So in that scenario, patient starts having severe chest pain with sweating, shortness of breath, and the muscles goes on dying. So the more time will elapse after this coronary occlusion, more muscles will get damaged. It is said that up to 20 minutes the muscles will survive, and after 20 minutes the more it will be delayed, more and more muscles will lose. So this is heart attack, and after this the most important thing is to open that block so that the coronary blood flow is re-established, the muscles get their blood and oxygen and they survive. So the earliest you can open this block, the earliest you can or the most you can save the heart. That has to be understood by the viewers, and that is why we said minutes are muscles. So the more minute you lose, the more muscle you lose. So that is why after a patient has a heart attack or has a severe chest pain, he has to rush to the emergency. The doctor also has to rush to the emergency, who will perform the angioplasty, and this operation is called primary angioplasty. So taking the patient instantly to the cath lab, doing an angiography, seeing the site of block or detecting the site of block, and with the help of wires, balloons and stents to open that block, this operation is called primary angioplasty, which is usually same as normal angioplasties, apart from the fact that this is done in a critical situation. The patient is very unstable, he or she is suffering a heart attack, his blood pressure will be low, his pulse will be low, his oxygen saturation will be low, maybe that patient will be ventilated, and in such a scenario, in a crisis situation, this operation is performed. So, a primary angioplasty has a little bit higher risk than normal angioplasty, but this is by guidelines, this is so far the best treatment after angioplasty, because the alternative treatment of giving medicines and trying to dilute the blocks, that is far less effective than this primary angioplasty. So this is performed in our hospital day in and day out, 24/7. We are ready to do this, and every time we try to reach, or we try to make the patient reach our cath lab by 30 minutes of from reaching our hospital, and as early as possible we need to open this block. So this is regarding coronary artery disease, how a heart attack occurs, and how primary angioplasty can save a patient from heart attacks.